Welcome to Denture Care for CNA Caregivers. This information is provided by the Texas Oral Health Coalition. Daily mouth care should not stop because a patient has missing teeth. In fact, taking care of dentures in the mouth is just as important as brushing their natural teeth on a daily basis. Dental health is important because dental disease and mouth problems are common in the nursing home and homebound population. You have probably noticed that many of the persons you care for have problems with their mouths. Today you will learn about the importance of oral health for denture wearers and the need to determine a denture care protocol for your skilled nursing facility. We will examine proper infection control, and you will learn to identify visible mouth or denture problems. Finally, you will learn what supplies are needed and how to perform daily denture care. The mouth has been called a mirror of health and disease because there you may find signs of systemic diseases, microbial infections, and nutritional deficiencies. Signs of disease are often first seen in the mouth, so it is important to be aware of anything abnormal and report it immediately. Bleedy gums are not normal, and any bleeding in the mouth while eating or brushing should be reported immediately to a dental professional. Oral health and general health should not be thought of as being separate. Cardiovascular disease, diabetes, malnutrition, stroke, and pneumonia are common conditions in many of the patients you care for. Poor oral health can make these medical problems worse because of the increased bacteria in the mouth that spread to other systems of the body. Daily oral care reduces the bacteria load and will help prevent making other health problems worse. Remember, daily mouth care does not stop because a person wears dentures. In order to determine a daily protocol, you must first establish who will be responsible for the daily cleaning. A recommended strategy is to encourage the morning shift to insert dentures and clean the denture container. The evening shift can remove dentures, clean the patient's mouth, visually inspect the patient's mouth and dentures, then scrub dentures clean. Dentures, whether full or partial, should not be worn all day because wearing dentures can constantly irritate the gums and cause worse problems. Leave dentures out at least 6 hours per day to allow the gums to breathe. If a patient insists on wearing them at night, remove for a minimum of 30 minutes a day. During shower time might be a nice compromise. Dentures that fit poorly may irritate the gums and cause sores that are painful for patients. Some patients need to sleep in their partials or full dentures to maintain an open airway while they sleep. Check with their dentist when patients are admitted for patient-specific instructions. Oral care is infection control because you are preventing the spread of bacteria to other systems in the body. We all know the importance of pericare, but oral care is just as important and requires strict procedural guidelines that caregivers should always follow. Always use clean gloves when working with dentures or cleaning a patient's mouth, and never use the same gloves before or after delivering pericare. Never share dentures or cleaning supplies between patients. Regulations state all dentures must be labeled, and please make sure the denture container is as well. Some patients will have full dentures because they no longer have any natural teeth. We refer to this as being edentulous. They may have a full upper and lower denture, or a full upper and a partial denture on the lower. All dentures should be labeled with the patient's name. In an edentulous mouth, you will see the bony ridge where the teeth previously were. In time, the patient's bone may start to resorb, causing the bony ridge to reduce in size and dentures to become loose. Loose dentures may require relining, so refer the patient to a dental professional as soon as possible so they may be fitted properly. For those new to working with patients that have dentures, you will need to learn how to tell which is an upper and which is the lower. A bottom denture will be open for tongue placement as seen in the picture on the left. A top denture will cover the palate or roof of the mouth as in the picture on the right. Some patients will have a partial denture, which means they have some of their own teeth. This removable partial will have false teeth on it and may even have a metal framework. For patients with any natural teeth in their mouth, you will need to remove the partial to brush the natural teeth and also brush the partial denture. You may find most patients wear their partials full time and don't soak them overnight. They still require daily cleaning, and patients should be encouraged to let their gums breathe for at least 30 minutes a day. It is extremely important to visually inspect the mouth and dentures separately each and every day. Your goal is to identify visible mouth and denture problems, and should you see anything abnormal, report it to the nurse immediately so that a consultation request can be made to the dentist. To perform a visual inspection, you must always wear clean gloves. You will need to use your fingers to retract the cheek out gently to inspect the bony ridge on the outside and inside for any white or red patches. Next, gently pull the lower lip out and check for any ulcers or sores. The sore on the right is from an ill-fitting denture. If a patient complains that it hurts to wear their dentures or they don't fit properly, have the nurse refer to a dental professional immediately. White patches that have a cottage cheese-type texture may be a sign of a fungal infection called candidiasis and should be reported immediately for professional medical treatment. You may see white patches on the tongue or gums, and in a severe case, such as the picture on the right, it may completely cover the tongue. This fungal infection can also spread into the lungs and other body organs, so it should never be left untreated. If you see white patches in the mouth, examine the denture carefully, because it will probably be on there as well. Both patient and denture must be treated by a dental professional. Next, check for black mold on dentures and in the denture container. You may be able to remove mold by scrubbing the denture and denture container with a denture brush using a drop of bleach diluted in water. But sometimes the mold is so embedded in the acrylic, which is the pink part of the denture, only a dental professional can remove it. Some facilities will not let staff use chlorine bleach, so they will need to refer to a dental professional for proper cleaning. Next, check for red spots on the roof of the mouth. Petechiae, or pinpoint-sized red spots, that are usually a sign the patient is wearing their dentures too long. If they do not go away by removing the denture several hours a day or all night, refer to a dental professional. A larger single red lesion could mean something else and should be reported for immediate referral. Always take a quick look at the tongue. Check the top, sides, and underneath for any red or white lesions, and report immediately for referral if any are noted. Last but not least, always check the removable appliances for any cracks, chips, fractures, loose teeth, or framework, and have repaired immediately. Before performing any denture or mouth care, assemble the supplies you will need for the morning or evening care. When a patient awakens, They will need their teeth to eat breakfast, so have your supplies ready. Items you will need in the morning are gloves, dentures, powder or cream adhesive. You can use one or the other or both, but patients seem to do better with using powder on the upper denture and cream on the lower denture. Dishwashing soap and denture brush to clean the denture container, and paper towels to thoroughly dry the denture container. Because you get a tighter seal when both surfaces are wet, it is helpful to put a non-alcohol mouth rinse in a small spray bottle, marked with the patient's name, of course, and use it lightly to spray in the patient's mouth. You can use water also, but you'll find that patients like having that fresh taste and breath. In the evening, the supplies you will need are gloves, a clean towel or washcloth, their denture container, their denture brush, dishwashing soap, mouth rinse in a spray bottle, and a toothette or clean washcloth. In the morning, put on clean gloves to rinse off dentures and insert clean dentures in the patient's mouth. If dentures are well-fitting, they may not need an adhesive. If they are loose, you will need to use a cream and/or powder adhesive. Always start with a clean mouth and a clean, damp denture. First, wet the top denture and sprinkle powder adhesive on it. Then lightly spray the roof of the patient's mouth with their mouth rinse and insert the denture. By wetting both surfaces, this should create a tight seal. Before inserting the lower denture, place dots of cream adhesive in the channel as seen in the picture. If the denture fits loose, apply cream adhesive in a thin spaghetti line and then insert into the patient's mouth. Never put so much adhesive on that it spills over to the outside. More adhesive is not better. After inserting dentures, rinse the denture container and lid well, then dry completely with paper towels and leave empty. If there is any moisture left in the container or on the lid when you close it up, it will grow mold easily. Dentures and denture cups must be cleaned daily and fresh water used to cover the dentures at night. Plaque will also form on dentures and partial dentures, so daily cleaning of dentures is just as important as the daily cleaning of natural teeth. Before bedtime, put on a pair of clean gloves to remove the patient's dentures. After removing the dentures, place the dentures on a clean towel or washcloth in the sink. Clean the patient's mouth first before scrubbing the dentures by moistening a clean washcloth or toothette and remove the food debris, plaque, and denture adhesive by gently wiping the top and lower gums inside and outside the bony ridge. Next, put a drop of dishwashing detergent on your denture brush and scrub off the plaque, the food particles, and denture adhesive on the denture teeth, including the outside and inside of the denture, under running water. After cleaning, inspect the denture for any broken, chipped, cracked, or loose pieces and uncleanable accretions. If any accretions cannot be removed by brushing, report it to the nurse so they may refer care to a dental professional. Denture cleaning tablets can be used in addition to cleaning with dishwashing detergent and water, but are not a substitute for dishwasher detergent and water scrubbing. Always rinse dentures thoroughly before putting up. Lastly, place clean dentures in a marked personal container and cover with fresh water. Dentures should always remain covered in fresh water when not in the mouth. And remember to change this water daily. Daily mouth care benefits older adults in long-term care by minimizing medical problems and improving quality of life. Older adults whose mouth is free of disease and pain may be more cooperative, which may help nursing staff to provide more efficient care.